Does more protein in enteral nutrition change outcomes for critically ill patients? Should clinicians consider a lower oxygen saturation goal for patients who are mechanically ventilated? We'll cover this and much more on this episode of the JAMA Editor's Summary. Hello and welcome to our listeners around the world. Today is Friday, June 13th, 2025. I'm JAMA Deputy Editor Dr. Linda Brubaker, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief for JAMA and the JAMA Network. For this episode, I'm joined by JAMA Deputy Editor Dr. Preeti Malani. JAMA Associate Editor Dr. Seymour also joins today's episode. He is an intensivist and will guide us through the JAMA articles featured earlier this week at the Critical Care Reviews meeting, commonly called the CCR meeting, in Belfast. Hi, Preeti and Chris. Let's get started.
Hi, Linda. Chris, please tell us about the new critical care findings published in JAMA and presented at CCR this week.
Hi, Preeti and Linda. It's great to be able to share our new critical care research findings published in JAMA. The first trial is augmented enteral protein during critical illness, the target protein cluster randomized trial. So this study is tackling a very important question in critical care, whether we should give more protein to our patients to try to improve the very common muscle atrophy and weakness that happens during critical illness. This trial was cluster randomized, crossover design, and open label, and came from the ANZICS Clinical Trials Group in Australia and New Zealand. Participants were critically ill and were enrolled at 8 intensive care units and were receiving enteral nutrition. Now, the intervention arm received augmented protein similar to what's recommended in clinical practice guidelines, and this was compared to usual care, with the primary outcome being the number of days free from admittance to index hospital and alive at day 90. Now, the take-home point from this very large trial was that, in fact, there was no benefit to augmenting protein in this patient population. We note this is a cluster trial. It was not randomized at the patient level, and the intervention was unblinded. But in the end, this is a very important piece of evidence, and we look forward to how the guidelines will be updated with this new trial.
Thanks, Chris. What a great trial and an important topic. What's one pearl that you think a practicing intensivist could take away from this trial?
I think right now, the practicing intensivists should just continue their normal practice. Recent evidence would show that almost 4 out of 10 patients aren't getting augmented protein anyway. And so it'll be fascinating to see how the guidelines are updated, and then we can modify our practice.
This is helpful evidence that addresses a long-standing clinical question. And JAMA has another trial featured at CCR that investigated oxygen therapy in the ICU. Chris, could you give us the highlights of this trial?
Sure. The second trial is called Conservative Oxygen Therapy in Mechanically Ventilated Critically Ill Adult Patients, the UK ROCKS randomized clinical trial. So this study, again, is tackling a very common problem in the intensive care unit, is how we target oxygen for those patients receiving mechanical ventilation. So these investigators conducted a multi-center, pragmatic, randomized trial in 97 intensive care units in the UK. And there were more than 16,000 participants who received mechanical ventilation, were receiving supplemental oxygen, and they were randomized to either receive oxygen at the discretion of the treating clinician or oxygen titrated to the peripheral oxygen saturation goal of 90%. In this trial, the primary outcome was all-cause mortality at 90 days. And in the end, the investigators found that patients assigned to the peripheral oxygen saturation goal of 90% did not have a significantly reduced all-cause mortality at 90 days compared with the usual care group.
Fascinating. And there's an accompanying editorial in which Dr. Seitz and colleagues praise the UK ROCKS trial's practicality, enrollment size, and methods using fit-for-purpose regulatory approaches. The authors stress the need for more large, pragmatic trials like UK ROCKS, as these trials can provide up-to-date, evidence-based insights into common treatments used in clinical settings.
Linda, I totally agree. The ICU clinicians are making decisions all the time using weak or non-existent evidence, and trials like the UK ROCKS are very much needed.
Chris, thanks for bringing these studies to us and discussing them today. It's been great to chat with you. We look forward to more high-impact critical care research in the future.
It's been great. Thanks for having me.
Aside from all the critical care research we published this week, JAMA also published an original research study evaluating the effect of intrapartum sildenafil on perinatal outcomes. Dr. Kumar and colleagues explained the rationale for the study. Phosphodiesterase type 5 inhibitors like sildenafil have been shown to increase uteroplacental perfusion in both human and animal models. Clinicians wondered whether there could be a clinical benefit to sildenafil. In this randomized clinical trial, pregnant participants were assigned to receive oral sildenafil citrate during labor or a placebo. The authors report no difference in the incidence of the primary composite outcome, which included several adverse perinatal outcomes like intrapartum stillbirth, neonatal death, low APGAR scores, neonatal ICU admission, and acidosis at birth.
Next up, JAMA published some thought-provoking viewpoints. Dr. Jacobs and colleagues discussed recent orders from the U.S. Department of Homeland Security to remove Harvard University from the Student and Exchange Visitors Program. They explained the crucial role of international medical graduates and trainees in American healthcare and advocate for urgent policy safeguards to protect immigration pathways in graduate medical education. There's also a viewpoint by FDA Commissioner Dr. Makary and Dr. Prasad, the director of the Center for Biologics Evaluation and Research, in which they lay out the FDA priorities, including goals like healthier food for children and using AI-based modeling instead of animal testing to predict toxicities.
In a separate viewpoint, Dr. Berger and colleagues share their experience as physicians at San Quentin State Prison working with the Condemned Inmate Transfer Program. And Professor Zettler and colleagues explain the recent FDA review of Novavax's COVID-19 vaccine.
Dr. Grossman and Erica Chung described the strong rationale for removing FDA restrictions on mifepristone prescribing. The current requirements are mandated under the Risk Evaluation and Mitigation Strategy Program and include a patient agreement form, a prescriber agreement form, and pharmacy agreement form that can make access to abortion care difficult.
In their perspective article, Dr. Allen and Tabari discussed the Stateville Penitentiary malaria studies. Often referenced in conjunction with the Nuremberg trials, the authors argue that Stateville offers researchers, clinicians, and public health professionals important lessons that go beyond the complexities of informed consent.
In the JAMA Insights article on trauma-informed care, Drs. Gerber and Antonowski share important principles to remember when delivering trauma-informed care with helpful clinical examples. And this week's patient page explains the coronary artery calcium score, including who should consider the test and out-of-pocket costs.
We invite you to read the latest JAMA medical news at jamamedicalnews.com or click the link in the show notes to find the latest articles in clinical medicine, biomedical research, public health, and health policy written and researched by our outstanding JAMA medical news team.
Thank you for tuning in to hear what's new this week at JAMA. These highlights were brought to you by Dr. Chris Seymour, Dr. Preeti Malani, and me, Dr. Linda Brubaker. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com, and thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.